Good afternoon, everyone. I can see the numbers going up. I'm just going to wait a little bit longer to make sure everyone gets on before we start this afternoon's webinar. I definitely want to welcome everyone to the webinar. My name is Kay Huff, and I will be your Benco host for this afternoon. Benco host for this afternoon, I should say. I definitely want to thank all of our Benco customers and all of our Benco associates for all your help in sharing these webinars that we've been putting on for our customers. We really appreciate that very, very much. So just to let you know, today you will be receiving CEs for your webinar. So I just want to go over the CE guidelines. Number one, please make sure that you used your legal name to register. And by that, I mean the name that's on your license. Number two, if you're registered, you must watch it on your own device. So if two of you are registered, you must each be signed in on your own device. This way we can see who's logged in, and we actually track your name by login. So that's very important. Also, it takes about 30 days to receive your CEs. So if you haven't received it, don't panic. They will come. If something happens and you don't receive it, just let us know and we'll do a follow-up. You'll also receive a survey at the end. We would love to know your opinion and also even comments about maybe what you would like to see in upcoming webinars. So please make sure you fill that out. We absolutely appreciate it. Also, if you're logging in on your telephone to watch this, if you're dialing in with your phone number, we can't see that. So what we ask is that you please send us your name, the title of today's course, and your telephone number to practicecoaching@benco.com. I'll also share that with you on the end, but it's practicecoaching@benco.com, and then we'll be able to connect those two dots and give you credit for today's webinar. Also, there at the very bottom, you'll notice there is a Q&A. We definitely will be going over some of the questions that you ask live. So all you have to do is click on the Q&A, type your question in, and then Chuck will be going over that, and they'll be able to discuss it live while we're on today's webinar. So with all that being said, I'd like to introduce the most amazing leader in the dental field today, and one that I'm so lucky to work for, one of our managing directors at Benco Dental, Chuck Cohen.
Well, Kay, thank you very much. I don't know that I'm an amazing leader, but I will tell you that we are with an amazing leader today, and that's Chad Kahani. So thank you very much. So this is the second time that I've had the opportunity to spend an hour with Dr. Kahani. The first time, one of the things I asked him about, and he really is a man who needs no introduction, I asked him was, what is it like to be the president of the ADA at this time? Usually when someone signs up to be the president, it's sort of uneventful. Dentistry is the same last year as it is next year. So Dr. Kahani really needs no introduction. He's had a higher profile as president of the ADA than anyone in my memory has. He signed on to this job not knowing it would become a real challenge to dentistry, and he would have the honor and the challenge to be the president during a very trying time in dentistry. So Dr. Kahani, thank you for being with us here again today. And we very much appreciate everything you're doing for dentistry and appreciate the time.
Chuck, thank you very much. And you use the word challenge. I am known to turn the challenges into opportunities. So I am so fortunate and grateful to God that God gave me this opportunity to serve my profession during the time when the profession needed some steady hand, some steady mind who can think on his feet properly and guide our profession. So I am grateful to God. I am also thankful to the members of the American Dental Association for giving me a chance to serve them as their servant leader. So, you know, it has been an honor, pleasure, and a wonderful thing that I will always cherish for the rest of my life, to be the president of the American Dental Association, and of course, meet with great people like yourself and many others.
Well, thank you very much. And thank you very much for everything you're doing, and thank you for taking the time today. So the first question is, it's been 7 months since the pandemic started in the middle of March. Tell us how you would describe the state of dentistry today and sort of where you see things going over the next few months.
Absolutely. I think we met in the month of April, and at that time the things were quite dicey. Every day we learn more about our common enemy, which is the virus. We are on very careful path to recovery, with 99% of the dental practices happen to be currently open and functioning well. The dentists have been able to practice safely and prudently with the guidance and support provided to them by the tripartite and the American Dental Association. The ADA has been able to provide 2.6 million face masks and 504,000 gowns and to almost 55,000 dentists around the country. And when I say dentist, I am talking about we have provided this service to both the ADA members as well as those dentists who have chosen not to be the ADA members. And I would appeal to those people who are not the ADA members that this is a good time to support your own profession by joining the American Dental Association. Our profession, the dental profession, has proven that we are resilient. We will not back down. The American Dental Association has our back, and together as a united profession, we are moving forward, and the patients trust us, and that is more important.
Well, thank you for sharing that. You mentioned a lot of things that have gone on in the past few months. What do you think is the biggest success that the ADA has had in over the past 6 or 7 months since dentistry shut down? You mentioned a lot of success. Which one is the one that you're proudest of?
I'm proud of both, but I can tell you one thing. Legislatively, we have done wonders. Our legislative success are beyond one's even imagination. And together, by being together and working together, we happen to do so many things. Our legislative successes are very clear. Getting the PPP for all the professionals, and about 90% of the dentists have applied for financial relief through PPP, and they have got it. Provider Relief Fund, another great success. Emergency Injury Disaster Loan Fund, another wonderful success. The ADA just voiced its support to the House Bill 7216, which would offer small businesses a tax credit up to $25,000 for the cost of PPE. And I believe last week, we passed in the Congress, not in the Senate yet, but in the Congress, something which will repeal famous or infamous McCarran-Ferguson Act, which gives undue advantage to the third-party payers. This vote was passed by simple voice of vote, and that is a great achievement for the American Dental Association. As far as our service to the patients is concerned, patient safety is our #1 priority. Patients trust dentists more than they trust anything else. I think we are #2. We are just #2 by Center for Disease Control, which happens to be #1 in patients and other professionals paying attention to the COVID-19 information. The team members are with us all the time. So, you know, I'm very proud of all those successes.
What do you think it is in dentistry that promotes that level of trust? What do you think, I mean, as a practicing dentist yourself, what is it that promotes the level of trust that patients and Americans in general have in their dentist?
Well, because the dentist always think of what is in the best interest of their patients. They at that time don't think of the profits, but they think of what's in their best interest. And they take time in speaking to their patients. They also become part of the community in any given business. If you are part of the community, you gain the trust, and the dentists are known to gain that, and they always think of what is in the best interest of the patients. They always treat their co-workers, which is our dental team, such as the dental receptionist, dental hygienist, and dental assistant, as part of our family. I definitely treat my dental assistants and my dental receptionist as part of my family. We have staff who have been working in my practice for the last 30 years, the same staff. So becoming part of the community is very important, and dentists are known to do that.
And looking out into the future, let's talk a little bit about what happens. I mean, I think there's a lot of forecasts that in the winter, we're going to see a spike in coronavirus again, and maybe it gets mixed in with the flu season. A little commercial, everyone should get a flu shot. We all know that. How do you see the winter playing out over the next few months, and what happens if and when the coronavirus starts spiking again? How does dentistry get impacted?
Let's talk about the dentistry first. The ADA is working very hard to ensure that in the event of a major COVID resurgence, patients will have access to a full range of dental treatment, whether it is due to this pandemic or the next pandemic or any other future disasters or natural calamities. Because of we play a very vital role in the health of the patients. Good general health begins with good oral health. The ADA has provided the state dental societies with advocacy resources to urge the state, local governmental agencies and officers to recognize dentistry as an essential health service. The ADA House of Delegates will be considering our interim policy, which we just passed about, I would say, 4 weeks ago, that dentistry is an essential health service. And our House of Delegates within the next 2 to 3 weeks will be considering that same interim policy and passing it by the full House. And I see no problem in getting this policy passed unanimously by the entire House of Delegates. We all understand that oral health is an integral component of systemic health, and the press understands that, and the public officials understands that. Dentistry is an essential healthcare service because of its role in evaluating, diagnosing, preventing, or treating any oral disease, which can affect the systemic health. If you recall, many people pretty much know that if you stabilize the oral condition, a periodontal condition of a diabetic patient, you will save a lot of money from the insurance point of view. It is almost like $124 per patient per month. So besides also giving patients good general health, you're also saving money elsewhere. Governmental agencies such as Department of Homeland Security and the FEMA, Federal Emergency Management Agency, have already acknowledged dentistry as an essential service that is absolutely needed to maintain the health of all Americans so that they can sustain their health and take care of their body properly. So I am quite confident that if we have a second wave which we call it COVID resurgence. We are in a good place and we will not have a shutdown in dentistry. And before I finish on this topic, I want to congratulate our dentist colleagues throughout the country who in the month of March and April, when we did not have enough science and we went into so-called shutdown state. I say we never shut down. We just slowed down the dentistry because at that time we did not have enough science and knowledge. Our dentist colleagues all across the world kept their offices open for emergency treatment. And they were treating emergency patients because our dental community understood they had a job to do to keep the American public out of any dental trouble. And they served our country so well. So I'm proud of our profession and I'm proud of our dentist colleagues all across the country. And I salute them for doing what they did during the time when we did not have enough information. So thank you, our colleagues.
Well, and Dr. Kahani, that's a big change from the last time we spoke. The last time we spoke was before dentistry was very focused on becoming essential, to use your term, essential healthcare. What's changed over the past couple of months? I mean, certainly today, going into potentially another COVID resurgence, I think what you're saying is that dentistry has declared, and others agree, that to shut down dentistry is bad for the overall health of Americans. When did that come up and how did that happen? This shift in thinking?
I'm going to take off my ADA president's hat and I'm going to just talk to you as a regular, normal person who is not the ADA president. So let's talk what has changed. Back in the March, we did not have enough knowledge about transmission. All that we knew about was what President Trump called it as a Chinese virus that was imported from somewhere and which got transmitted by person-to-person contact. That was the fear. So at that time, social distancing was important. So we thought that we wanted to provide social distancing, which we still do in our dental offices. My dental office used to have 14 chairs in my reception room. Right now, we have only 4 chairs in our reception room. So we are still providing the social distancing. But back in the month of March, we just thought that if we don't see any patients, then there will be no transmission. We did not have enough knowledge at that time. Over the last 7 months, we have not seen any significant transmission of COVID-19 transmission in a dental setting. None. We treated emergency patients in the month of March, April, and May. Globally, there were many other dental offices which were wide open, treating many patients. There is not much knowledge, or at least you could say documentation of transmission of the virus under a dental setting. We have been open in United States since, you could say, by middle of May, June, July, August, September.
Yes.
And we haven't seen any dental transmission. The dentists are very much trained to control any infections. You remember during the AIDS
I do.
time in
I do.
80s?
I'm old enough. I remember.
Okay. That was the end of the world. What came out? We actually started treating our patients in more safer environment, and dentistry got even better. Again, proving the same thing. dental profession is very resilient. And the same thing is happening over again. What will happen now is we will be treating our patients in a slightly different environment. You know, the disposable gowns are perhaps they have come to stay. Using the N95 mask have perhaps come to stay. Hand gloves have come to stay. Taking the temperature of the patients upon entry in the dental office is not a bad idea. Pre-screening the patients prior to making an appointment or 24 hours before the patient comes to the dental office is a great thing to happen. So we live and we learn and we always come out to serve our profession in a lot better and more efficient way, and more than anything else in a safer environment. And that's happening right now. And I'm very proud of our profession.
As well you should be, as well we all are. And so a lot of the things that you mentioned as you went through the changes that have happened in dentistry have come directly out of the ADA toolkits that have been issued over the past few months. Can you talk a little bit about, maybe a little inside baseball, how were those created, and what do you think is going to be the lasting impact from the toolkits and the general changes in the way the profession is operating?
When I first thought of creating the ADA toolkit, or even creating a task force for return to work, it was not an easy thing for me to do with the bureaucracy at the American Dental Association. But looking back, almost every member of the American Dental Association and almost every board member have called me or sent me an email or in some form communicated to me that that was one of the smartest thing that Chad Gahani did in the middle of April. You thought of return to work toolkit and you created the task force. And the task force, by the way, is going to be meeting today, this afternoon. And I sit on every single task force meeting. And we keep updating our document, return to a work toolkit. We keep changing it, updating it almost every 4 weeks, 3 weeks, depending upon how soon we want to change it. But that's a living document that our members and practicing community rely upon. It gives you a lot of information about what you need to do in your dental practice. It also tells you what tools and how you want to communicate with your patients. That works wonderfully. I also want to caution our dentist colleagues. The patients like to hear from their own dentist. The best tool that Chad Gahani can use to communicate with the public is through you, my colleagues, my friends, my practicing dental community. You are very well equipped to tell the patients how important it is for the patients to go to the dentist and how safe dentistry is. The media, of course, very well understands it, and thanks God, we have a lot of support from media. We have also created hazard assessment tool where the dentists are able to comprehensively assess risk factors such as local disease transmission rates, patient and treatment specific issues, and facility consideration. A supplemental checklist to guide also helps the patients helps the dentist from time to time. We also have the protocols that if the staff member or a household member of one of the dental staff's family has a positive COVID-19, what needs to be done and how we need to work with that particular staff member. If the staff member wants to take a leave because of COVID-19, we have guidelines for that as well. So I will ask our practicing community to log on to ada.org/virus from time to time and see the updates in our flow chart and in our guidelines, because what you saw in our toolbox a month ago, today it will be a lot different. So we keep updating it. And please continue looking for the updates every now and then.
Thank you. One of the things that comes out from the conversations that I've had with some of my dentist friends is there's some confusion. It could be state driven, it could be nationally driven, how to handle the situation where a staff member, a team member is diagnosed with COVID or has a family member who has COVID or has been exposed to COVID. There seems to be confusion on how to handle that. What is the ADA doing to try to create a clear message on what to do about a team member who comes down or is exposed to COVID?
We actually have a flow chart on our ada.org/virus website about if the member or a family member of our staff has COVID-19. And that can slightly differ from state to state. Majority of them are pretty much similar. Also, there is a responsibility for the employer under the Families First Coronavirus Relief Act, also known as FFRCA. And we have to follow that. And again, in some states, we hear stories which occasionally can keep me up late in the night, and some other jurisdictions, it hasn't been as complex as some other places.
Got it. Thank you very much. So looking out into, I think we would all agree the coronavirus is not going away anytime soon. As we look at issues and questions around testing, as we look at issues around vaccinations, what role do you think dentistry might play in how our nation and even around the world, how we fight against the coronavirus, and specifically around testing and vaccinations?
Well, if I had my magic wand,
I'll give it to you. I have a magic wand. Here it is. What would you do?
If I had one, I would provide point of care testing to every single dentist, and they should be able to test their patients at the point of care. Unfortunately, we don't have, FEMA does not have enough testing that they can provide to every single healthcare provider. So I don't see any reason why a dentist, with all the specialized training that the dentist goes through, rigorous training in the school, dentists are very, and you sell your products to the dentist, you know how demanding and how detailed a dentist is. Mm-hmm. Every dentist is very detailed. They are thorough. They enjoy, I call them Mr. or Miss Perfectionist. That's us. That's dental community. Why can they do a point of care testing? Diagnosing a COVID-19 disease per se is a different story. But I think one day we should be able to at least lay our hands on testing. Vaccine, ideally, if the pharmacist can give vaccination, why can't a dentist do vaccination? But then that differs from state to state. At the present time, there are about 4 states in the United States where a dentist is able to provide vaccination. The ADA policy at that time, I'm not talking about COVID, but I'm just talking about vaccination in general. We don't see a problem there, but then again, that's a scope of practice and every state differs.
Well, one thing that was interesting, the ADA and the Health Policy Institute had a seminar, a program that Marco Vukovic
Yes.
Hosted a few days ago. I thought it was interesting that when asked, less than 50%, only 44% of dentists said they would like to be able to administer a vaccination were one available. It was a lower number than I expected. I expected more dentists to want to sign up and say, if I'm able to give a vaccine, I'd like to do so. So 44% seemed kind of low to me, although 31% said maybe. So maybe they were on the fence about that.
Yeah, that's the reason about reluctance on part of majority of the dentists is the storage requirements, and there are other finer details in providing and storing and getting the vaccination in a timely manner, and then doing the bookkeeping and all that. So those are purely, it's more than just a scientific reason. It is more than just the scope of practice reason. It is more about, is it practical for a busy practitioner to also lay his hands in the process of vaccination? But are the dentists qualified? Are the dentists trained enough? I would say, to be a dentist, and I really don't have to speak to my dentist to remind them of how vigorous our dental school was and how well trained all of us are in providing good care. What's the difference between infection and inflammation in the mouth against in the finger or in any other part of the body? Infection, inflammation, any disease process and repair is same in oral cavity as anywhere else. The dentists are doctors of the mouth. They are the real doctors, and they know much more than just the mouth conditions.
It's true. So pivoting a little bit, let's talk about the ADA. How do you think this current crisis has changed the ADA? As an observer, it feels like the ADA has really stepped up between you and Kathy O'Loughlin and Mike Graham on the lobbying side. How do you think this experience or this challenge has changed the ADA itself?
Let's talk about the ADA annual meeting. This is the first time that the ADA annual meeting is going to be virtual. That's something new at the ADA. The ADA FDC, that is Florida Dental Congress, Virtual Connect Conference will bring a lot of learning, networking, and community to the dental profession until we are able to meet again in person. We still want to maintain our community setting together with our colleagues across the country. This year's conference is called ADA FTC Virtual Connect, which is presented in partnership with the Florida Dental Association. A live and on-demand experience with quality content and connections that a dentist will expect at an ADA annual meeting will happen virtually. This is the only way we can make sure that our members are connected and engaged to each other. We will have continuing education opportunities. We will have virtual exhibit hall, and I hope you are part of our virtual exhibit hall. We will have evening sessions that will include COVID-19 and beyond, leading a profession through uncharted territory. That will be our one of the sessions. The essentialism of oral health, how dentistry fits into an evolving healthcare landscape, Our third-party payer landscape, which is what many practicing dentists are always enthusiastic to learn more about them. We will be having a lot of other teaching, academics, and a lot of other things that will happen at the same time. What will our new normal at the ADA will be? Our new normal will always be with possibilities of many great opportunities, and that's what I strongly believe in. And we will be more creative. In the short period of time between the middle of March until today, I'm very proud of how creative we have been. We have created a virtual platform for our incoming dentist, which is our new style of testing the competency of the graduating class so that they can get licenses. The examination is called DLOSCI, Dental Licensure Clinical Structured Examination. And that examination is based on computers only. There is no patient examination or working on the patient involved. And within a very short period of time, as soon as we announced opening of DLOSCI, about 6 states in the United States accepted that DLOSCI as one of the format of licensing dentists. And many dentists across the country now are licensed by just taking the DLOSCI, this is called a real creative, you could call it disruption, but I call it a creation. And it is an innovation in the right direction. Our academic field will change, and it will change for better. We will have a new way of teaching our incoming classes. Our whole experience in the educational system will change.
That's very
exciting. A lot of good things will happen.
So that's very exciting. I want to peel that back a little bit. So what you're saying is that starting now, the dental exam, the post-dental school dental exam won't involve live patient work by the dentist or the dental student. It will all be done on the computer. That's very interesting. And I think
yes.
You've taken a big piece of the terror out of the dental exam for dentists.
Yes, and the good news is within a month's time, less than a month's time, we were able to assist the State Dental Association. I would give credit to the state dental associations who actually went to their state legislators and they brought up that change. What is ADA's role there? Our role is to assist the State Dental Association in helping them bring about some nice creative changes in their legislators in their respective states. And we are always ready and prepared to assist our state organizations to do so. And when I was campaigning as as a candidate, Chad Gehani, I talked about speaking with one united voice for the entire profession. This is a perfect example of one united voice for our entire profession. While I was a candidate, I always used to talk about that one day ADA should be at the fingertips of every dentist. And I used to flash this phone like this. I can proudly tell you that we have started working on digital member experience. That means this year was the beginning of the digital member experience. As we go forward, I can tell you that my dreams are coming true. And they're coming true rather much faster than many people thought that they will come true. So I'm very proud of what our association, the American Dental Association, has done during the past 12 months, in spite of us fighting with COVID-19. A lot of great things are happening at the ADA.
And let's talk a little bit about one of those successes has been the legislative work that Mike
Yes.
Graham and his team have done in DC and Washington. Do you want to talk about that for a minute and just give a quick recap of some of those successes? Because I think everyone would say dentistry punched above its weight in terms of the reaction and the involvement of the folks in Washington.
Well, if it was not the ADA and if it was not Mike Graham's team, 90% of the dentists who applied for financial relief through PPP, personal, I forget the full form.
Paycheck Protection Program.
Paycheck Protection Program.
That's right.
That would not have happened. The Provider Relief Fund, for example, it was originally created for the Medicare practitioners, which is mostly physicians and very few dentists. They were for the Medicare practitioners only. The ADA went up to the hill and they said, well, we need to include dentists. And in the beginning, the rumor was that only the Medicaid providers will be included in the Provider Relief Fund. But it so happened that we were able to open up the doors to every single practicing dentist. And that was one of the wonders that the ADA has done at the Washington, at our Washington office. Emergency Injury Disaster Loan Fund, EIDL, which gave grants up to $10,000. It was $1,000 per employee per practice. So if you had 10 employees in the practice, you got up to $10,000, but no more than $10,000. Those were all big bucks. At one time when we went and approached FEMA, FEMA did not even know what dentistry is all about. We went and we persisted that we are one of the essential health service. We are number 4 from the top in the preferred providers list in the FEMA. And FEMA has already accepted dentistry as an essential health service. That's a major achievement. And not only that, we were able to provide free KN95 masks to every single practicing dentist, regardless of their ADA membership.
I thought that was, go ahead.
Say that again.
I was going to say, I thought that was pretty amazing that
Yes.
the ADA advocated for all dentists, not just ADA members. Can you talk about that for a minute or two? What went into making that decision?
Well, we have to look at our actions from the global point of view. What is more important to us? What do we exist for? We serve the public, and the public is most important to us. So do we now have to sit down and say that the public, the patients who don't go to a non-ADA member should not be in the safe hands? We always think of what is best for the profession. And during the emergency time, during these hard times, the best thing that we can do for the profession was to give opportunity to everybody. And that's why I'm appealing to the dentists who are not our members. Please, if you want to thank me, don't thank me by sending me flowers. And I have received tons of flowers, greeting cards, and a lot of other things. Don't send me anything. Just be an ADA member. And that will be the biggest thank you you can do to me by becoming an ADA member. At that time, when we made the decision, we were thinking of the overall community. And we are not self-serving body. We think of the community.
Very smart. Let's talk a little bit about legacy. Where do you envision what do you envision your legacy will be? The ADA has been in business as an organization for long more than 100 years. I think it's getting close to 150 years. Certainly, this has been one of the most interesting times to be the ADA president. Talk a little bit about, if you would, how you would like to be remembered for your time as president.
I believe the House of Delegates, who pretty much the entire House of Delegates, they love me, and the Gehani family loves the House of Delegates of the American Dental Association. And many of the members across the country know me and my wife and two of my children very well, and they all call me as their servant leader. And I'm proud to be a servant leader of the American Dental Association, who led the profession of dentistry globally during the worst healthcare crisis of the mankind that we can ever remember.
Well, that's quite impressive. When does your term officially end?
My term will officially end on October 19 to 2020 at
Gotcha.
5 p.m.
So not that you're counting or anything, but you know exactly how many days it is until, and that's at the ADA annual meeting, correct?
That's the end of the annual meeting, and I'm looking forward to serve my successor, Dr. Dan Clemenson, who is an oral and maxillofacial surgeon and an MD. He will do a wonderful job. The ADA is in good hands, and ADA will thrive and do very well.
So have you spent more time as the ADA president this year than you thought you would? Has it been all-consuming?
I was prepared to spend my past 2 years as a president-elect and as the president of the American Dental Association before I decided to run as a candidate. I gathered with my family. My children, my wife had a little bit concern about if I'm going to be able to spend that kind of time with the ADA. And dentistry has given me much too much. Dentistry has been very kind to me. And at my stage of my life, I wanted to give something back to dentistry. So for the past 2 years, I have been sleeping an average of 3.5 hours out of 24 hours. And the rest of the time, I'm on my feet or I'm on the desk. The last 6 months, I've been sitting on the same desk, except that in the month of March, my computer was sitting on the cardboard boxes because I did not have a desk in my living room. Right now, I have a little bit nicer desk in my living room. But I sit in the same chair for about 14, 15, 16, sometimes 17 hours doing my work. And, I thank God for giving me all that energy.
Well, wonderful. And then when your term ends in a few weeks, because it's coming up very quickly, what will you do with all this newfound time? How are you going to spend your time going forward? And most importantly, I'll give you a softball question. How will you honor your wife, who has been very gracious in sharing you with the ADA? So I'll help you here a little bit. But what will you do with your time after your term is up?
Rewarding my wife will be a harder thing, so I'll come to that later on because you got me there. How will I spend my time? I have the offers from the industry to work for them. They are under consideration. I have an offer from a New York City, a large group where they want me to spend some time with them, and that's being considered. I have some teaching opportunities, and I also have an opportunity to serve our dental community in some appointed position, and that's also under consideration. So I'm going to have some serious discussion with my family, and I know the time is running out, by this weekend. But I will be busy. I will not be staying home. I still have a practice to go to. I don't have as larger a practice. As you guys know, Dr. Gehani Associates, once upon a time, my practice has shrunk because I have neglected my practice for the last, I would say, 6 or 7 years, serving as an ADA trustee and then serving as an officer for 2 years. My wife is the best thing that God has ever given it to me. My wife and my 3 children and 6 grandchildren. So I do not know if I can do enough to thank my wife, my 3 children and 6 grandchildren. So that's going to be a hard act for me to actually, I have no words and no action that I can do will actually justify how much sacrifice my wife, who is an orthodontist and who is a former chair of the Council on Dental Education and Licensure of the American Dental Association. She still is a member of the Council on Dental Education of the ADA and a former chair of the New York State Board of Dentistry. How much sacrifice she has made in my growth professionally, there's no way I can compensate that with any of my actions or any gifts that I can ever give it to her.
Well, that's very nice. I'm sure you'll figure out something though. You'll try and you'll keep trying and you'll try and you try like all husbands do. So well, good. I like that and we applaud that. What's the message that you would give to younger dentists? Are you still as excited about the profession as you were when you started? What do you feel like a younger dentist should know about the profession?
The profession is very resilient. It's a great profession. I wish I was a young dentist now because the profession is just emerging and getting much stronger day by day. So this is the profession. If I have to choose over again, if I was 21-year-old, a college graduate, and if I wanted to decide what is it that I want to do so I can serve the community, be the boss, and also make a nice living for myself and my family, I will choose the dental profession again. There are so many great opportunities in dentistry that are emerging now that were not existing when I was a young dentist back 40 years ago. It's a great profession, and I would encourage every young person to think that way. I will also tell the younger people to get involved. Get involved in your own profession. Get involved in your own future. If you want to change your future, you want to make your future bright, be part of the American Dental Association. Be the leader of the American Dental Association. Make other people join the American Dental Association. I have always said that. United we stand. And I have always said, and I believe in this, the American Dental Association has our back. Why would we not support a professional body who has our back? So be assured that the ADA will always be there for you at the time when you need the ADA.
Well, and I know from my conversation with Mike Graham recently, one of the things that makes the ADA and dentistry in general unique compared to other healthcare professions is the percentage of dentists who are actually a member and involved and engaged in the ADA. It's one of the things that Mike Graham says gives him a lot of credibility when he goes to visit the congressmen and the senators in Washington.
Oh, absolutely. When you tell them that you represent 164,000 members of the American Dental Association, when you tell them that most of the people, 62.8% of the practicing dentists or the members of the ADA as compared to blank. I will not name any other professional organization. That's huge. That carries a big stick. And I can tell you one thing, because I have been to White House about 3 times as the president of the American Dental Association. I've been at the Capitol Hill few times, and some of the senators have come to our American Dental Association's townhouse that we have at the back of the United States Congress. They come to see us, and we are proud to represent our members in the Washington, D.C. office. It's an honor.
And thank you very much for doing it. So we do have 1 or 2 questions, Dr. Gahani, that I just wanted to ask you to follow up on some of the things you mentioned before. One that I thought was interesting was, now that we're getting rid of the live patient requirement for dentists, do you envision that same requirement going away for hygienists and other dental team members, or is that just for dentists at this point?
Well, at the present time, it is for the dentists, but I don't see in future why it could not be for everybody. But you have to take some baby steps. I remember, and I wasn't there, I was actually not born, but I have read it in the history that when we created National Board of Dental Examination back in 30s, I remember coming to United States in 1975. At that time, New Jersey and Delaware were the last 2 states in 1975 who accepted National Board of Dental Examination as a written examination requirement part of getting a license in those 2 states. So it took them from mid-30s to 1975, almost 40 to 45 years. So this is a slow process. I cannot look in your eyes and tell you that every single licensing jurisdiction is going to accept the Delosky tomorrow. But we have made great strides. 6 states in 1 month. And this Delosky was not even scheduled to be launched this year. We were planning to launch it next year. I had to fast track it because of COVID-19. We did a lot of fast tracking. So people thought that the ADA offices are closed. ADA staff were working 24/7. One thing I told my ADA staff before I left ADA on March 16th is make sure that our member services are uninterrupted. They should actually be doubled up. And our ADA staff, we have 460 loyal ADA staff members who have actually worked real hard. So if you want to thank Chad Gahani, no. Thank the real people at the ADA in Chicago who have really worked hard and made us look so nice.
Well, I can't think of a better way to end our conversation today than on that note, a thanks to the ADA staff and a thanks to a shout out to the ADA members and ADA and other dental auxiliaries like hygienists and assistants. So thank you very much, Dr. Gahani. Dr. Gahani, on behalf of the dental trade and the dental profession in general, thank you very much for everything you've done over your term as ADA president. I know it's coming to an end. It's probably ending in a way that you did not anticipate, but you certainly were the man for the job, and we appreciate your stepping up and we appreciate your service. So thank you very much for today, and thank you for your time in general.
Thank you, and it has been an honor and privilege to serve. Thank you.
Thank you very much. Okay, we'll turn it back over to you.
Sure, thanks.
Great job, both of you. I mean, it was amazing. You kept me on the end of my seat. Dr. Gahani, I love your passion. You can just feel it in your voice when you talk. I will say this, if you're ever our way, you have to come visit us at Benco's headquarters. We would love to take you on a tour of that. I think, Chuck, wouldn't that be a great invite to bring you in?
Absolutely, would love it.
So Yeah, we're
Thank
gonna have
you.
to put that on the calendar because you've done 2 webinars for us and we really appreciate it. So, Alyssa, you want to pull up the slides real fast? So first again, we want to thank you again for your time. Again, please come by. We want to set up a time for you to come in and visit our
I
headquarters.
will absolutely do that. Thank you for the opportunity and thank you for the invitation to visit with you.
Thank you, Dr.
Absolutely.
Gahani. Nice to see
Thank
you.
We would
Thank you.
enjoy it.
Thanks.
So everybody that's on, I just wanted to remind you that if you will, go to the next slide, please. If you will actually just take your phone and scan over the QR code, it will take you to our website, which will give you our upcoming webinars and workshops, which you will be able to view on our website.
Yeah.
And then also I want to talk to you about a webinar that's coming up next week. It's going to be really good. It's going to be on the oral cancer exam and what happens when we find something. It is, there's so much oral cancer out there that we miss or not being diagnosed because maybe we're not doing the exams correctly. So Dr. Confessor is going to be giving us a presentation, and then Linda Miles from OCC is going to be talking about an organization that helps sponsor family members that are diagnosed with that. So you're not going to want to miss that. It's going to be Wednesday, October the 7th from 6:45 to 8 p.m. Eastern Time. I also want to tell you about another one that's going to be coming up with Leslie Canham. Again, the PPE information is constantly changing, and we just want to make sure we keep you updated. So that's going to be on Wednesday, October the 21st from 7 to 8 p.m. So please make sure you put both of those on your calendar. And I told you earlier that if you had any questions or any feedback, this is the email address to send it to. It's practicecoaching@benco.com. Again, that's practicecoaching@benco.com. Please let us know how we're doing. Let us know what you would like to see more of, and we will make sure it happens. Thank you both again for an awesome interview today. It was fantastic.
Thank you.
Have a good evening.
Thank you.
Bye-bye.
Bye.